Hi, so the lecture is about Whipple disease. Whipple disease is caused by a very important organism called as Tropherma whipple. So, Tropherma whipple or whipple. It's a gram positive organism. It also stains pass positive. So these are some important MCQs that I'm straight off telling you. Okay, and it involves it's gram positive, pass positive. On biopsy, you can see the macrophages that are present, macrophages in lamina propria, and that's because of the TV play already being present there. Okay, that's very important. Next is what are the symptoms, okay, or what are the clinical features. The patient comes with the symptoms of steatorrhea. They also come with the complaints of mesenteric lymphadenopathy, mesenteric lymphadenopathy, mesenteric lymphadenopathy, and abdominal pain. But is it the only complaining feature? Well, when you're looking at, we look at it as one of the most, we look at it as a GIT disease rather than a CNS or a CVS disease. But obviously, it has other involvements. So before we look at the other involvements of this particular disease, I really want to explain why this entire process is actually occurring. So let's say this is the villi, and here there are the lacteals. Okay, the lacteals. They carry the fat. That's basic knowledge, right? So what happens is that these lacteals are blocked by these organisms, and because of this, the mesenteric lymph nodes, okay, the mesenteric lymph nodes are involved. So there's mesenteric lymphadenopathy. First of all, they are enlarged. Second is that there is obviously steatorrhea. All the fat that is getting absorbed is not being able to enter into the lacteals, and because of that, there is steatorrhea. All right, there's fat loss. Is the other, uh, the other parts, let's say the glucose and protein absorption actually hampered? Well, relatively less. But which part of the intestine does it affect? It actually affects the entire intestine, but you should remember that proximal more than the distal. Here it has a age predilection which is 50 to 60 years, and it usually affects male more than females. Okay. Now, after explaining the pathology of this particular disease, okay, let me get to the very important point that I had to make, is that it has extra intestinal manifestation, and that is joint manifestation, CVS manifestation, and the CNS manifestation. If there is a CNS manifestation, that means it's in severe form, but joint manifestation is seen before the intestinal manifestation, and it's seen as a small joint migratory intermittent polyarthritis. Small joint migratory intermittent polyarthritis involving involving the lower limbs. Okay, it involves the lower limbs. So that means the small joints in the lower limbs, your distal toes, etc., can show intermittent polyarthritis. And this can come as a clinical vignette where there is a patient who's coming up to you, and before anything they say that there is a lot of joint pain, and at the same time probably a few days later they come up to you and they say also, you know what, there is this one particular presentation of the feces being really clayish and foul smelling, and there is a lot of osmotic diarrhea that can also be seen. So obviously you need to think about that as well. And apart from that, it also has a CVS symptom, which is endocarditis, but it's culture negative endocarditis. Obviously you have to rule out the various causes of endocarditis before you come up to this cause. It's relatively rare. You have to think of your important Jones criteria. You have to think of your Duke's criteria and stuff like that. And then after all of that, you want to go into the Hasek organisms as well. After you've eliminated all of these Hasek and Streps and Staphs and all the gram positive ones that can cause endocarditis, you want to jump really into your T. Whipple. Okay, and the CNS symptoms are the one that are correlating with a bad prognosis, have a bad prognosis, and that's obvious. It is obviously showing a dementia. It's showing rapidly progressive dementia. It's also showing myoclonus, myoclonus, opsoclonus, and arrhythmias. It shows supranuclear palsy, very important. And how do you diagnose it? As I told you, you do a biopsy. Okay, in the biopsy you can see the macrophages in the lamina propria. Also, you stain it with PAS and you get a PAS positive. That's very diagnostic. And if you want to do, you could do a PCR assay, obviously. Okay, you could do a PCR assay. Now, how do you want to treat it? How do you want to treat this particular condition? You give ceftriaxone, and ceftriaxone is a third gen cephalosporin that should be given. Or you could also go for a meropenem. Meropenem is an imipenem. Okay, you could give that as well. And if you want to prevent for long term as a prophylactic, okay, to prevent the relapse, you give cotrimoxazole, a sulfur based drug. Okay, so that's about Whipple. And I think we've covered most of it. Thank you very much.